Good afternoon, everyone. Thanks so much for joining us. My name is Emily Wengrovius. I'm one of the county liaisons here at CDHS, and I'm joined by my counterpart, Kristina Mueller, as well as Mark Mackert and Susan Nichols from ARD. So thanks again for being here. If you have questions as we're going through the presentation, please not hesitate to type those in to either the questions part or the chat. So without further ado, I turn this over to my colleagues, Mark and Susan.
Thank you. Good afternoon, everyone. I'm glad you could join us this afternoon. So today's webinar and presentation is to go through a high-level overview of information that was contained in the 2013 Child Maltreatment Fatality Review Report. So just as a little bit of background, we'll go ahead and talk a little bit about the evolution of the process over the last few years and how that relates to this report in particular. So prior to 2011, the CDHS had some limited authority to conduct fatality reviews. So up until that point, they did conduct fatality reviews. They were on child maltreatment fatalities where there was prior involvement in the prior 5 years. And those reviews were conducted in a less formal manner, and that includes the manner of the review as well as any final report that would come out of that process. House Bill 1181 then codified the authority to do the reviews through the Child Fatality Review Team. It also provided funding for one FTE to the Department of Human Services. What's important in terms of the numbers overall and trends in this report in particular is that it also established that child maltreatment fatalities would be reviewed by the team when the family had prior involvement with County Department of Human Services related to child welfare services in the previous 2 years. It also had a few exceptions to that. So if that prior involvement, if this situation did not involve abuse or neglect, if it occurred when the parent was 17 years age or younger, or before they were the parent of the deceased child, or the situation occurred with a different family composition or a different alleged perpetrator, those could be set aside and did not necessarily need to go through the full review process. In 2012, Senate Bill 12033 then added the review of near-fatal and egregious child maltreatment incidents to the responsibilities of the CFRT. So that was done partially to help create better alignment with CAPTA in regards to the near fatalities. Left everything else the same, just brought those two populations in. House Bill 13255 in 2013 then provided funding for 2 additional FTE for the CFRT process, but specific to what it means to this report and the team, it also changed which incidents qualified for the full review, and it did that in 2 ways in particular. The first is it lengthened the time to be considered for prior involvement from 2 years out to 3 years. And then secondly, it removed those exceptions that we just talked about earlier that were put into place through House Bill 1181. So what that effectively does is, as we look at this report and we go through the data, it will limit our ability to interpret trends a little bit, because as we see numbers increase or decrease over the years, it's difficult to interpret them and to know whether that was due to these timeline changes going from 5 years prior involvement down to 2 years and then back up to 3 years, if it was due to removing some of those exceptions, or for the last couple of years, has it been due to individuals, county caseworkers, becoming more familiar with the definition of egregious child maltreatment or what a near fatality is. So there's a number of factors in play, so it does make that hard to interpret the kind of trends over time. So I know as we move forward into the future, we're looking forward to those staying more consistent through statute so we can begin to interpret trends a little bit. The other thing specific for this year is statute had required the completion of this annual report. What it did is push that back to July 1st is now the due date. So this is the second annual report for the Child Fatality Review Team, just done a few months later this year because statute allowed until the end of July. If we go to the next slide real quick, you'll see an example of what I was referring to by some of the trends, and we'll talk a little bit about the difficulty of interpreting them again. So if you look in 2012, there were a total of 78 children that were reported to the Department of Human Services from county departments as being involved in a suspicious incident of child maltreatment that resulted in a fatality, a near fatality, or an egregious incident. In 2013, that went up to 116. In particular, if you look, the largest increase was in the egregious incidents, where it went from 5 in 2012 up to 35 in 2013. Now again, that statute only applied to part of 2012, so that's, one indication that those numbers would be smaller. And again, back then prior involvement was 2 years, not 3, and there were still those exceptions in place. So it's hard to know what created that increase overall. So 2012, I think, would not really be a year that we would look at as an indicator of a baseline number. 2013 is getting closer, although again, the statutory changes occurred halfway through 2013, so that may not even be a complete baseline year for what numbers we might anticipate under the current statute and guidelines. But again, I think that gives a pretty good example of some of the fluctuations and changes. If we go to the next slide, this slide provides a high-level overview of just those incidents related to calendar year 2013. So starting on the far left, you can see that there were 116 children where we received information from a county department that they felt this met the definition as a suspicious incident, and that was across 111 different incidents. So in other words, there were a couple of sibling groups involved in these. For fatalities, that was 56 children over 55 incidents. Near fatalities involved 21 children and 21 incidents, so no sibling groups there. And for the egregious incidents, 39 children and 35 incidents. So it's important in that column to remember is those are all suspicious incidents. If you go to the next column, you'll see the number that were substantiated. In other words, determined that these were the result of child maltreatment. So you can see it drops down to 23 children and incidents for fatalities, 15 children and incidents for substantiated near fatalities, and 38 children over 34 incidents for egregious incidents, again, where that was a founded allegation. Those would be all the incidents throughout the state. To then meet criteria to be reviewed by the full CFRT team, that's where the other criteria come into play, where that prior involvement had to be in the last 2 or 3 years, depending on when the incident occurred and which statute was in place. So for those, out of the 23 substantiated fatalities, 8 of those met criteria to be reviewed by the full team. 10 of the 15 near-fatal incidents met criteria, and 21 incidents out of the 34 egregious incidents met criteria, and again, that involved 25 children. So overall, there were 43 children that met criteria for review across 39 different incidents. Real quickly to kind of go through the timeline of when all these different processes come into play. Statute is pretty specific around timelines we get within each of these timelines. So when a county becomes aware of an incident that is suspicious for child maltreatment and meets the criteria as an egregious, near fatal, or fatal incident, statute requires that they provide notification to the Department of Human Services within 24 hours of becoming aware of that incident. CDHS then has 3 business days to post that information on our website, and the information that goes up there is the type of incident, gender of the child, age of the child, whether they were in their own home or in foster care at the time of the incident, and whether or not it meets criteria to be reviewed by the CFRT. Often at that 3rd business day, we don't know that last piece yet because we don't know if the assessment's going to be founded or unfounded. So that last one ends up being updated at the conclusion of the assessment by the county department. The county then, as they go through their information and complete their assessment, they have 60 days to provide to us at the Department of Human Services a lot of the information that's relevant and necessary for the review. So that would be any assessment, findings, interview notes, a lot of that information we pull out of trails. But it could also include law enforcement reports, coroner reports, medical reports from providers, information from school systems, things of that nature. At that point in the process, statute does allow us to provide an extension. Oftentimes, you may not be able to get the law enforcement reports or medical reports within those initial 60 days, and so we can provide extensions. We generally do those in 30-day increments, and then within that 30 days, just stay in touch with the county department. If we get that information sooner, we move into the process. Once we have all the information, then that gets disseminated out to the team members. They will meet and do their review and discussion of the incident. County departments who had prior involvement are invited and encouraged to attend and participate in that discussion. At the conclusion of that team meeting, we in ARD then have 55 days to create a draft report and submit that to any county who had prior involvement for their review. The counties then get 30 days to do their review and provide us with feedback. And that feedback can range from comments around grammar or certain language choice. It can certainly include providing additional information that might help clarify any policy violations or systemic concerns and or recommendations that are made. When the county gives us their feedback, we then have 30 days to finalize the report. So during that 30 days, we go through the feedback. Oftentimes, a lot of the edits are straightforward, and we go ahead and make those. Other times, they may involve more of a conversation with the counties. So in those instances, we would schedule a teleconference or meet with them in person just to walk through any concerns and information and try to collaboratively come to a resolution as to what should be in the report. We obviously want them to be factually correct and any recommendations to be really directed specifically at what any findings were throughout the review process. Once the report's finished, we then have 7 business days to get it posted on our webpage. There isn't one exception to that, and that is if we get notice from a district attorney's office that they have pending or ongoing proceedings, they can ask us to not post the report until the conclusion of their cases. So in that case, we just ask them to send us a letter stating that they want us to withhold it because they don't want it to impact or interfere with the work that they're doing. And we post that letter instead. Then we stay in contact with the district attorney's office. At the conclusion of their work, we would then ask them for a letter stating that they don't have an objection anymore, and we can go ahead and post that report, at which time we would post it. So overall, it can be a fairly lengthy process. It can take up to 6 months to get through the entire process, depending on if there were extensions needed up front, if DAs have requests to not post the reports. So what this page is showing is kind of where we're at for the 2013 reports.
We have a question really quick, Mark. Let me see if I can pull it up. Just a second, y'all.
So it looks like you're asking if the PowerPoint can be emailed out to participants. We do have a PDF version of it that we can email out. I don't know if we can do it. Can we do it right now live while we're doing this, or at the conclusion? We
can try to email it out. It was in the email that you forwarded to me?
Mm-hmm.
Okay.
Yep.
We can send it out to you guys.
Okay. So yes, we will get that sent out. So regarding the 2013 reports, the status of where we're at with those, you'll see that 33% of those are completed and posted. That means the actual report itself is posted. There's an additional 43, almost 44%, where the report is complete. The entire process is done, report's done, but we do have a district attorney who has requested we not release the report, and so for those, we have actually put their letter up instead. So all said, you've got roughly 74% there, or 76%, where those are completed. The other 23% are still in progress, and there's always a little bit of lag from year to year. Those incidents that occur towards the end of a calendar year are going to overlap into the next calendar year in terms of when they actually get completed. So that's where we stand at the moment for the 2013 reports. So that was a lot of information just about the process itself and kind of where we're at. What we're going to move into now is more of a discussion of, out of the 2013 incidents, what are some of the basic demographic and kind of other information related to these cases that we have. So the first area we really start in is child characteristics. And for race and ethnicity, Again, this is looking at all of the substantiated incidents. So not just those that met criteria for review, but all of the incidents themselves. So the first chart is showing you the race ethnicity of all the fatalities, near fatalities, and egregious incidents by type. And you'll see for us the highest percentage, kind of depending on the type. So for near fatalities and egregious, it would be white, slightly higher fatalities for Hispanic. Nationally, 38.5% of child maltreatment fatalities, the children are white, 31.9% are African American, and 15.3% are Hispanic. So you can see in Colorado in particular for those last two, we're a little reversed. The Hispanic tends to be higher than the African American. The next slide, we'll look at fatalities specifically. And the reason for that is that has been tracked for a longer time in Colorado and nationally. So we have more data and can try to look a little more longitudinally at trends. So this again is for all the substantiated fatalities over the past 6 years. And I think one of the interesting things to look at again in regards to where Colorado may be a little bit different than nationally is the makeup of this race and ethnicity again. So for us, that Hispanic is higher than nationally. Although I think if you sort of look at our census data, that's also true for us. In the 2010 census data, 71.1% of Colorado's population was white, 4.1% African American, and 20.6% Hispanic. So in some regards, that difference for Colorado fits within, that is a difference for our general population as well. I think it's important too to point out when we calculated these, how we calculated Hispanic. When you're in trails indicating race and ethnicity, Hispanic is not listed as its own. So in other words, you could indicate white Caucasian with Hispanic ethnicity. And so when we calculated these, what we did is looked across all of those. And if Hispanic was indicated, we placed that child into the Hispanic category. That matches how some research is done nationally within child maltreatment. It also matches how the Census Bureau is considering calculating race ethnicity in the next round of their data. So we're trying to stay aligned with how some of the research is and then also aligned with the direction the Census Bureau is moving. So if they go to that, I think that would be interesting again to kind of go back and see any impacts that has on the overall census data for the state of Colorado and the makeup of our overall population and how that might then correlate differently to some of these charts. But again, over time, you'll see white has been the highest within, except the last 3 years, Hispanic really has become the highest. So that was sort of a reversal for us starting in 2011. Now, 2013, it was pretty close, 8 Hispanic, 7 white. So relatively equal distribution between those two in terms of being the highest. The next slide goes to looking at gender. As you can tell, across all 3 categories, the majority involve males. A little less for egregious, where it's about 60%. Near fatalities were 80%, and fatalities were 70%. Nationally, for the national data, oftentimes we only have for fatalities. Not all states have moved to collecting the near fatalities, and again, because that's newer, there's not as much data. And then not many states have the egregious. So that's why for the national data, we're looking mostly at the fatality. But again, nationally, it was just about 58% of child maltreatment fatality victims were male. So we're similar in that that's the majority. Obviously, at the 70% in 2013, we're a little bit higher than that national average. If you look at the 6-year trend, it has gone up a little bit over time. So back in 2008, it was roughly 55%. And you can see it's kind of incremented up over time all the way to 2013, where we're now just below that 70%. If we look at the age of the victims, again, across all of the incidents, whether it's fatality, near fatality, or egregious, you'll see the vast majority are young children, below 1, definitely below 3. If we actually jump ahead for a moment to the next slide, because it's going to look similar. This will show you across the years the age of folks for fatalities. And you'll see that below 1 is always the majority of these. And then if you look at that below 3 category, it's the vast majority of those. And that matches the national trends. Nationally, approximately 70% of fatality victims are 3 or younger, and 44% being younger than 1. So that aligns pretty closely with the data that we see in Colorado. One of the other areas that we looked at and tried to collect data on, so those were all characteristics specific to the children. We tried to look at family characteristics as well in terms of trying to look at other risk factors or what other information might we be able to glean from these that could inform practice. So this next slide is looking at the family structure for those families of the 76 victims. And again, this is across the fatalities, near fatalities, and egregious incident. And overall, the majority of these took place in families with 2 biological parents, so just about 51% of them. And it varies a little bit by type. So egregious incidents, that was 66% of the time. It was in a family with 2 biological parents. For fatalities, it was 48%, and near fatalities, 20%. So you can see pretty big difference between the egregious and the near fatal. The next category that was next highest was 1 biological parent with 1 unrelated caregiver. So still a family dynamic where you have 2 potential caregivers in that household. Important to probably note there were 4 incidents that did occur in substitute care settings, which included daycare and foster care. We also tried to look a little bit at other family stressors. So what other types of activities or issues were taking place within the families. And mainly what we found as we looked across them was issues related to substance abuse, domestic violence, and mental health. And for us, the substance abuse, we had combined alcohol and drugs, so it's a combination between the 2. So nationally, when they looked at this, 6.3% of child maltreatment fatalities involved alcohol abuse, 17.3% involved drug abuse, and 20% involved domestic violence. So in Colorado, again, we had the 8.7% involved substance abuse, 17.4 had some history of identified domestic violence, so that's pretty close to that 20%. And then 17% there was a history of mental health treatment. So again, kind of looking across what other dynamics were taking place within that family environment in the past or even at the time of that incident. I think one thing that's interesting, if you look, there were more near fatal and egregious incidents involved domestic violence than did fatalities. So for the near fatal, it was 53%, little over half, and egregious incidents, just about 45% of those. And that really, if you think back to the earlier slide, aligns with that high prevalence of incidents that were occurring in a family composition with 2 caregivers. So again, in terms of thinking about potential risk factors or other dynamics taking place within that family, that 2 caregiver having 2 individuals in the household and that overlap with domestic violence and child abuse and neglect, I think is an important one for us as a system to keep looking at more closely and figuring out how we best work across those 2 systems, meeting the needs of the families and in particular the kids. We also looked at the prior history of the victims, and again, this next slide is going across the fatalities, near fatalities, and egregious. Interestingly, nationally, if you look in child maltreatment, it indicates that 8.5% of child fatalities involve families who had prior CPS involvement in the past 5 years. If you look across, for us, the fatality is the blue. So if you look at there's quite a bit of difference between 2012 and 2013 in terms of the overall percentage, but that's a little different. For us, that has ranged anywhere from the 35 to 55% between 2008 and 2013. And that can be a lot due to the data that different states put in, their particular definitions of substantiated or the fatalities, near fatalities, egregious incidents, things of that nature. In 2013, for Colorado, just about 35% of our fatalities had prior history. Now again, because of when statute changed for us, that means either 2 years, that prior history was either within 2 years or within 3 years.
Hey, it looks like we have another question, and it says, can we share the report with our best practice court teams and judicial partners?
So I'll have two answers to that. So one, yes, we can. If by we you mean us, the department, we can certainly do that. If you mean any of you at a local level, you can certainly do that as well. It is a public report. It's up on the department's webpage through ours at the Administrative Review Division. So you're certainly welcome to share that with any of your county stakeholders as you think that it would be beneficial in terms of having some good conversation about practice and things to be aware of and think through within your particular county. So yeah, I think that'd be great.
Great, thanks, Mark. And I'm going to try to look up the website, the web page, so that you all can see it and put it in the answer.
Perfect. So if we can go, before you do that, we can go to the next slide real quick.
Sure.
So we also looked a little bit at the perpetrator relationship to the victim. And again, this first slide is going to look across the fatal, near fatal, and egregious incident. And the majority of the fatalities were committed by the mother of the child, so 39%, and that means mother of the child alone. And that's slightly above the national average, which is 27%. The second largest category were fathers, and that was just about 22%. For near fatal incidents, most often, again, it was mothers acting alone, about 20%. Really after that, it was pretty varied in terms of that relationship. And for egregious incidents, most frequently it was the father acting alone. So a little different for egregious than fatal and near fatal. But again, for those egregious, fathers acting alone accounted for just about 32%, although that was tied with the mother and father together, which was also right about 32%. So both of those were 12 out of the 38 incidents. So again, a little different between the egregious and the fatal and near fatal in terms of what that relationship was between the perpetrator and the victim. So that's sort of a high-level overview of some of the more demographic data that we collected over the year. And again, our hope is as we move forward from here, we can keep collecting that and begin to watch for trends over time. It's, you know, we can begin to look at it, I think, have some good conversations, but it's at 1 year, it's still a little bit of point in time versus having some better longitudinal data in terms of a lot of this, such as the perpetrator or age. As a good example, in the 2012 annual report, the egregious incidents were much more often with older youth. And this year, the egregious kind of followed the same track as the near fatal and fatal, where they were younger children. So had we just looked at last year's, we might want to assume that those are more likely to be with older youth. Now we see this year, maybe that's not true. So again, pretty important, I think, sometimes to look at that longitudinal data. And for a lot of this, we just unfortunately need more time to collect that and see what those trends do look like over time. As we then went into the annual report, we tried to do a summary of throughout the reviews that were conducted by the Child Fatality Review Team, were there themes to their findings, and that's for both strengths and for gaps. So what was it over time that they were seeing as patterns across some of these incidents that they were looking at? So within the concept of the strengths, as we looked across them, there were really sort of four overarching themes we could put the strengths into, and those were assessment and documentation by county agencies. And really what those were in regards to were there were a number of times where the team felt like the documentation that was available in the county's assessment clearly supported their decision making and the efforts they made with that family and on behalf of those children. So again, really the importance of having the supporting information as to here's how we got to these different decision making points, both in this current incident and just as importantly in that prior involvement that we had with those families. There were a number of times specific to those prior assessments that the team felt like the counties that had that prior involvement did a nice global assessment of the status of that child and any particular issues with that family. So not doing an incident-specific assessment, but again, really a broader global look at the family and any needs they might have. The second area was child welfare practice, and that really ranged across a number of different topics, including overall engagement with families, being proactive and offering services related to assessed risk, having good cultural sensitivity in their work with families, really exploring the use of extended family, as well as a couple of times looking for absent parents and trying to get them re-engaged with that child so you had better placement options if those were necessary. And then there was a county that really exhibited supportive supervision for the caseworker who was assigned to that case, and that even included doing team meetings for a lot of those decision-making points so that that caseworker had support in making those decisions and didn't feel kind of on their own in terms of making those decisions that are really quite critical in the lives of these kids. Under the collaboration between various agencies, those crossed a couple of types of agencies specifically, one being law enforcement, and that specifically what they found is that when there was good collaboration with law enforcement, it tended to lead to a better assessment overall and streamlined services to the families. The other kind of common stakeholder agency that we collaborate with was the child protection team at Children's Hospital. That in a number of instances was a really important resource to counties. And when that coordination went well between Children's Hospital and the counties, again, it really helped make for some better informed decision making and provided some clarity around the extent of injuries to the children and potentially extent of abuse that had occurred for them. Under the services available, I'm sorry, so...
We have one really quick question. Sorry, Mark. What our plan is to do, we had a question of, can we also share the link of where our partners and stakeholders can go to view the webinar? It is our intention after this webinar concludes to upload it to YouTube and also post it on the county portal. So we can send you both the YouTube link and then you can also access it on the portal. Sorry.
No, you're perfect. So under the services, again, what that really looked at was there were a number of occasions whereas the team looked at those services, both current and past, they felt like they were a real strength, and that included an instance where the county involved a past foster family. That way, at placement, the children were going to a place that they felt more comfortable. There was a strong use of community services and support in a number of these incidents. Supervised visitation was noted as a strength in a few of them to, again, maintain some of that engagement between parents and children while the assessment was taking place, and the county could make a better determination as to both the extent of what occurred and proper decision making moving forward in terms of services and how best to engage with that family. Facilitated family support was another area, and victims assistance programming. So those are examples of some of the services that the team saw put in place by different counties that they really felt like worked well in those particular incidents. Related to identified systemic gaps and deficiencies in the delivery of services to children and families, there were 5 different sort of categories here. The most frequent was around the safety and risk assessment tools, and specifically the accurate use of those tools. So as an example, in 13 of the 15 reports that have been finalized, there were policy findings related to those 2 tools for a total of 32 policy findings. So that was a real frequent finding, was difficulty in terms of the accuracy of those tools. And there are recommendations in the reports around rolling out the new risk and safety assessment tools, and I know there's work taking place currently in regards to that. So hopefully in the near future we'll see improved efforts and findings around those. Related to policy, there were a number of times that, and as we talked about earlier looking at those charts, there is a frequent overlap between domestic violence and child maltreatment, in particular in these egregious near fatal incidents. And so one of the things, as the team discussed it, is they identified that statute and rule isn't very clear in terms of addressing domestic violence in the presence of children and how best to determine when, if at all, that intersects with abuse and neglect. So is domestic violence in the presence of children abuse and neglect? Are there other factors or criteria to consider in regards to that? So that was an area where some recommendations were made that the Division of Child Welfare work with some stakeholders and collaborate in terms of looking at that area, and is that something that could be teased out a little bit better and further strengthened so that workers would have better guidelines in that regard. Another area, and this also relates to domestic violence, was firearm possession by those convicted of domestic violence. So there was an incidence of domestic violence where, as the team was having some discussion and looking at what efforts could be done once law enforcement gets involved, it was actually discovered that in 2013 there was statute passed that indicated that protection orders can actually order a person to relinquish firearms. And throughout the discussion, it appeared that courts may not have all been aware of that change in statute, and that was something that was available to them. So there were some recommendations made around potential efforts to make sure that the court system was aware of that and knew that they had that as an option when they were looking at these types of cases. Under collaboration between agencies, we did talk about it as a strength. Probably not too surprising. Oftentimes, those similar agencies were found as a gap. So when collaboration goes well with law enforcement, it is a strength. When collaboration with law enforcement does not go well, it can be a hindrance in terms of finishing that assessment or, again, streamlining those services and the experience of that family. There were a number of times that included efforts to work with other states to try and determine what history that family had with those other states, and then some other community agencies as well. And that included the court system as well as families' own extended safety network. So oftentimes when safety planning is occurring and families are asked to help identify some individuals, there were a number of times those individuals were included in that safety planning, and that sometimes did not always work as well as had been hoped. And so that was another area of probably not collaboration with an agency per se, but again, collaboration with others who could possibly have an important role to play in maintaining the safety of these children. Systemic practice was another area, and that's related to a couple of areas. One example was the entry of substantiated findings when we have an unknown perpetrator. And so oftentimes in these, as the team was looking at it in the counties with prior involvement, we're having conversations. There would be times where physicians, for example, could tell us pretty definitively that these injuries were non-accidental. This was definitely abuse and neglect, but due to the number of people who potentially had responsibility for providing care for that child during the time frame when the incident occurred, you may not be able to identify an exact individual that you would say would be responsible for that abuse or neglect. And so there was a lot of discussion in those types of incidents of using a founded allegation on an unknown perpetrator. Another area that was identified was a need for additional secondary trauma resources for county caseworkers, obviously going through any fatal, near fatal, or egregious incident for those workers who are conducting the assessment, or for any workers who did have prior involvement and were responsible for any of that service delivery or case practice. That is a traumatic experience for them as well, and really identified that within Colorado at the time we had one primary provider for those services and really looked at a need to expand that network for the counties. There were some inconsistent documentations of reasons for not accepting assessments across that prior involvement. There was counties identified difficulty with the requirement of restricted cases. Not all counties had an individual with the restricted access profile. So once a case gets restricted, that meant they did not have access to a lot of the information in it, which obviously makes it difficult to continue doing an assessment. Or if several counties are trying to collaborate, that makes that difficult. So there were some recommendations around making sure each county was aware of how that functionality worked and had at least one individual in their county who would have that restricted access profile. There was also some inconsistent use of criminal background checks and information related to those for potential caregivers when looking at potential placement options for children. And then the case-specific practice, that really looked, kind of going back to again, we talked about this a little bit as a strength. There were some times throughout these where there was a lack of documentation that supported the decision making or lack of engagement with families or some deficiencies in assessment. So those were tended to be a little more case specific in that as we looked across other data, it didn't seem to be more systemic across the county or the system overall. So those are some examples of what would be under that category of case-specific practice. So overall, this summary of the policy findings, kind of by type, you can see on this slide, again, the highest was the accuracy of the safety and risk assessment. There were 15 times where the timeliness of the assessment closure was identified. 12 times selecting and meeting response times were identified. And that's one that's important to note, that as we looked back at the prior involvement or even the current one, rule changed around response times over years. And so we're really careful to make sure we're applying the rule that was in place at the time that particular assessment would have been done. And I think that's a good example of, as we do these reviews, we try to do that with all rule, of make sure that we pay close attention to when this prior involvement was and what rules or guidelines would have existed at that time and what the expectations for our system and workers would have been. There were 9 times where ongoing services were identified, so either services were not provided or particular services weren't that could have been. 5 screening, 4 reporting to CDHS, so not notifying us timely, in other words, and 2 times for findings, so not having correct findings in terms of founded allegation. So if you look at the recommendations that go along with those identified gaps, you can put those into some categories as well. So the majority of the time, the recommendations coming out of this process are related to really CQI activities. And depending on what that level of where that gap or deficiency was noted really drives where the recommendation would be. So you can see here 29% of the time the recommendation was around county level CQI. So really asking that the county go and take a look at practice specific to that area in their county. There was 23% where the implementation of the revised risk and safety tool and also conducting some CQI in the meantime. So in other words, we know we have new tools that we are working on rolling out, but in the meantime, we can probably take a look at our current practice as well and try to identify any local barriers that may be taking place. There's really not that substantial amount of difference between the current tools and the new tools. So a lot of that work that we might ask a county to do or even the state to do in terms of continuous quality improvement and looking at barriers, most of that's going to be directly applicable to the new tool as well. So again, the majority of those recommendations tend to be around that concept of asking counties to internally engage in some efforts to identify what barriers specific for them might exist, and then put strategies in place to reduce those barriers. 11% of the time we were looking at training or technical assistance, and again, some of that might come back from those conversations with counties if they had already identified some of those barriers and felt like that was an area that could help them improve in that particular area. There were a number of times where we looked at some specific practice and made recommendations related to that. That was 11% of the time. I think it's important to note there was some time where what we tried to do, if there was a particular policy finding or concern within any one prior involvement, is we try pretty hard not to make recommendations off of things that may be case-specific and not systemic. So to the extent that we can, we try to look at broader data available for that county or for the state. And if the county or state is generally performing pretty well, what we might do is make a recommendation that we continue monitoring trends. And you'll see that was 9% of the time. So while it may have been an issue in this one case, overall, it looks like 85, 90% of the time we're doing really well. Let's make sure we just monitor that trend and make sure we continue doing well overall. And that data can come from a number of places. It can come straight from trails. We can pull aggregate data from there. It can come from CSTAT. It can come from the Administrative Review Division reviews. Counties sometimes have additional data they can provide as we look with them across these issues. So those are examples of that 9% for the monitoring trends. And there's 6% for policy. There are times that as we're doing the reviews, we look and the team feels like that it may be a lack of clarity in policy or just a gap in policy addressing certain things overall. And 6% of the recommendations were related to policy. One of the things that statute does require is that we track the status of recommendations over time. So what we have done is partnered with the Division of Child Welfare. So when a report is finished, the Administrative Review Division goes in and puts any recommendations into a tracking spreadsheet. The Division of Child Welfare then is the more formal body within CDHS that provides the direct supervision of practice related to child welfare, picks up tracking the status of those and do they get implemented over time. And we meet monthly with them and we go over that tracking spreadsheet and look at the status of each different item and just try to stay aligned and make sure that things are moving forward. So this chart here just shows you a real high-level status of those recommendations that came from the 2013 reports that were posted on the webpage. So 64% of the recommendations have already been completed. 36% of those are in progress. I think what's important to note is some recommendations we would expect to take longer. I think a good example of that is the recommendations around the new safety and risk assessment tools. Rolling those out statewide is an effort that's going to take a longer period of time, so we would expect that one to be in progress for some period of time. There are others that are shorter and can be resolved in an earlier time frame, and those are the 64% that you're seeing there. So that's the split out for where we're at for the 2013 reports, which again, given that the highest number of those recommendations were around the safety and risk assessment tool, that 64% being complete is actually probably a pretty good number at this point. And as those tools roll out, that would complete and roll off a high number of these recommendations as well. One of the additional pieces in statute from this last year in 2013 was that the Child Fatality Review Team from the Department of Human Services worked collaboratively with the Child Fatality Prevention System in the Department of Public Health and Environment and make joint recommendations. So for this year, there were 2 joint recommendations that were made. The first one was around incorporating safe sleep education and how to address safety concerns related to infant safe sleep practices as part of the Colorado Department of Human Services Child Welfare Training System for child welfare professionals. We do have a member of the CFPS who sits on the CFRT, and we have a member of the CFRT that sits on their team. So we do try to have a lot of cross-collaboration between the 2 groups, and that was one of the overlapping areas that was identified was fatalities occurring with issues around safe sleep environments. So that was the recommendation coming from those. The second part was really wanting to look at or continue to look at prevention efforts. So that was the second recommendation, which was a recommendation to continue to provide dedicated resources for the implementation of Colorado's Child Welfare Plan, Keeping Kids Safe and Families Healthy 2.0, and really have an effort to make prevention programs for families with young children available in every county in Colorado. So really wanting to look at efforts to continue expanding those prevention programs. Again, I think the goals of both systems are take what we can learn from these incidents and do what we can to prevent future fatal, near fatal, or egregious incidents. So that's the conclusion of the presentation we would have in a high-level overview of information contained in the report. So again, the report is available on our webpage. It is a public document, so definitely feel free to share it with other stakeholders, use it within your county. If you have questions about it, feel free to reach out and contact us at any time. Our contact information is on the last slide there. I don't know if folks have other questions. At the moment, the question section is blank, but if others have any additional questions, we'd be glad to answer those at this time.
Thank you so much, Mark, for putting this together, and Susan for being here. So we'll wait a couple minutes and see if any questions come up. So. All right, we'll see. We'll just sit for just another second. It's always interesting to wait for a minute. Okay, it says, do you have the data that shows ethnicity and age?
So the data for each specific child, or the data overall at the aggregate level? So yes, we have the ethnicity and age. We walked through those charts earlier. So yes, we have the data that underlies those charts.
It says, I'm thinking of infant incidence.
So yes, we have that by age. So the infants would be those that we're categorizing as less than 1. Those would be the infant category. So those should be in the charts. Obviously, we have that associated to each specific child as well.
Does that answer the question? Also, please feel free to email Mark if you need more information or would like to discuss it a little further. So we're glad that we're able to provide this presentation to you all, and Kristina and I just really want to extend our thanks to our colleagues at ARD for being here today. So I think if you all have other questions, to please go ahead and send them along to Mark, and we look forward to uploading this to YouTube as well as posting it on our county portal. So tell your friends, tell your colleagues, and thank you so much for being here.